When I was the president of the City Board of Health in Lancaster. I was on the board with another physician, Bill Fife, who actually worked with Katie down at the Federally Qualified Health Center in town. But I didn't know about that at the time. And we had had a significant number of lead cases. Lancaster has about 4 times the national rate of lead poisoning in children. And unfortunately, our enforcement ordinance was very poor, and there was children that were or houses that were not being abated or taken care of for up to 2 years. Multiple children would be going into those houses, you know, just like any other rental property. There was a lot of turnover, and we got so frustrated on the board trying to tell the city administration that they needed to address this issue in a more comprehensive way, because these kids were being lead poisoned, and so Bill and I decided, you know, late one night, that we were so fed up. What we were actually going to do was list all the addresses of the affected homes in the paper. We're going to send a letter to the editor, and because we just didn't know what else to do. We were, you know, nobody was listening to us from a medical expertise standpoint. And just before we started crafting that letter, Bill said, well, you know, there's this attorney who works with us in our medical legal project. Her name is Katie. Let me talk to her. So apparently Bill talked to Katie, and Katie ended up writing a letter, right, to the mayor.
You know, I think just sort of had a casual chat with the mayor about it, and the mayor, I think, was sort of open to this and sort of invited legal services to kind of get more involved in sort of working with the city administration to revise the lead law. You know, and from there it happened pretty quickly, and I think
so. From my perspective, it was like Katie writes a letter, and like literally hours after that, stuff starts happening. Like, you know, everybody's all interested in lead. They want to know. They come to the Board of Health meetings. They're like, "How can we do a better job? Please help us. You know, take care of this." And Bill and I are looking at each other, thinking, "Why weren't we lawyers? I mean, we could do more changes in terms of people's health, and you know, just being doctors." So.
Yeah.
But it was through that experience, and then the city did rewrite the lead ordinance, and have done. There's still ways to go, but they've made big strides in taking care of the issue. And a lot of that's to credit Katie. And there's a lot of other infrastructure that needs to happen within our county to deal with the issue, you know, to finally get a handle on it. But that was the initial impetus, and from the new lead ordinance, we developed a lead coalition. We're starting a community engagement process, and we're trying to bring in concerned parents and people from the school system and realtors, and just trying to really develop a coalition of folks that we can engage in a real way to finally deal with the issue once and for all.
And it was nice to be involved at that end in terms of participating with the city in the rewriting of the ordinance versus at the traditional legal services office. So you see people when they are coming in, the kids are lead poisoned, you know, and so they're looking at, well, how do I deal with this from a landlord-tenant perspective? You know, are they going to withhold rent? Have they already been withholding rent, and now they're dealing with an eviction, and they're put in a defensive posture? So it's nice to really deal with it more preventatively in terms of really trying. And the law's not perfect, but I think it's improved quite a bit. And then these extra efforts in terms of the coalition building are really significant.
And our rate of lead poisoning dropped most significantly over the past year than it had in the previous 6 or 7 years. So I think a lot of that has to do with the ordinance and the interest that Katie helped generate around